On behalf of the AGNC committee, we want to talk to you about some changes that are taking place within our profession. Genomic medicine has been coming in for a while, and in England the focus has been on standardisation of testing through the genomic laboratory hubs. But that focus is now shifting towards patient pathways, and that includes commissioning of clinical genetics and genetic counselling services. So we'd like to tell you a little bit about what's been happening and what's going to be happening, and also how we as a profession can be involved in taking this forward.
There is a strategic focus on genomics for the next 10 years in the NHS Long Term Plan. All NHS Trust CEOs in England will be driving forward the new Genomic Medicine Service Alliances. The new Genomic Medicine Alliances will be coordinating the delivery of the mainstreaming of genomics. There are 3 alliances in nursing, medicine and pharmacy. Oversight for the whole service in England will be offered at a single point, that's the genomics unit at NHS England. One of the aims is to provide consistent, equitable, standardised clinical care across clinical genetics and genetic counselling services.
While this is only England at the moment, the devolved nations will also be watching what's happening as they make plans for how best they can move forward with clinical genetics and genetic counselling services. So this does have an impact on all of us.
It's incredibly important for us as a profession to be clear about what it is that we do, how we do it and why it's effective.
Take every opportunity to talk to mainstream colleagues about what genetic counselling is and what we do, and work with them as they'll be taking forward genomic healthcare alongside us. If you need some resources to help with this, we have some videos that explain the nuance of what genetic counselling is.
We don't yet know exactly the process of how genetic counselling services will connect to the Genomic Medicine Alliances, but the AGNC committee is working hard to make sure that the genetic counselling voice is heard in policy.
As the Trust is looking at our evolving roles, be part of this conversation. The career structure, which you'll be able to find on the AGNC website, defines the tasks that genetic counsellors may be involved with, and this may help you in those discussions.
As one of the named Genomic Medicine Alliances, the nursing profession will be absolutely pivotal in delivering the mainstreaming of genomics across the whole of the UK.
Take the opportunity to work with the nursing leaders within your trust to define how they will work alongside genetic counsellors.
The AGNC committee has already been in touch with nurse leaders to discuss how to get genomics into curricula, teaching, mentoring, support and competency to practice.
We are all representing our profession, so do take the opportunity to talk about genetic counselling and be proud of what we do.
Please do check the AGNC website for updates.